Most practice administrators check their medical exclusion lists at hire and maybe once a month after that. But a provider who clears your background check on day one can still lose their license or be barred from federal healthcare programs years into their tenure. If that happens and you keep billing under their name, your practice is exposed to minimum penalties starting at $10,000 per claim. The Office of Inspector General maintains the list of excluded individuals and entities. As of 2026, it holds over 82,000 active entries. And because the OIG updates this database on a monthly cycle, new exclusions are added continuously. Relying on a monthly screening schedule or an initial check at the point of hire creates a false sense of security. Providers become excluded throughout their careers, long after the initial credentialing process clears them. This bar chart compares recent civil monetary penalty settlements for exclusion violations. Notice the six-fold vertical leap from 2024 to 2025. In 2025 alone, 35 different healthcare organizations paid out more than $26 million in penalties for billing under excluded providers. Treating credentialing checks as a routine monthly chore leaves massive gaps in your risk management strategy. As federal enforcement accelerates, those gaps turn standard medical practices into active targets for audits and massive financial recoveries. The Centers for Medicare and Medicaid Services requires practices to check exclusion lists on a monthly basis at minimum, but following that minimum standard actually engineers a predictable lag in your compliance coverage. Look at this 30-day calendar. If a provider on your roster gets added to the exclusion list on the 2nd of the month, but your compliance software doesn't run its next sweep until the 1st of the following month, you create a 29-day blind spot. During those 29 days, you are still actively billing Medicare and Medicaid for their services. Every single claim you filed during that window is technically illegal and immediately triggers federal penalty exposure. The math on this exposure is brutal. Under the Civil Monetary Penalties Law, the OIG can issue a penalty of up to $21,000 for each individual service claimed. On top of that, they can recover damages up to 3 times the original claim amount. For Medicare Advantage, it hits over $47,000 per violation. The statute operates on the legal standard of knew or should have known. Claiming ignorance of an updated exclusion list is not a valid legal defense to avoid these penalties. By operating on a 29-day delay, a practice weaponizes its own routine daily billing cycle against itself. A high-volume clinic can generate hundreds of illegal claims before the next monthly compliance sweep even begins. Closing this gap requires human labor, and checking these exclusions is incredibly complex. The data is fragmented across dozens of separate, disconnected databases. This compliance network starts with mandatory federal hubs, OIG for Medicare exclusions, and SAM.gov for federal debarments. You also must monitor 50 individual state Medicaid exclusion lists. Finally, the NPDB continuous query tracks malpractice and licensure actions in near real time. Navigating this maze takes a massive human toll. Running these checks manually, name by name, across multiple lists, consumes up to 20% of a compliance specialist's monthly hours in a mid-sized clinic. Expecting human staff to execute flawless manual sweeps across 54 disparate databases is a computational impossibility. The sheer volume of data points guarantees that eventually an excluded provider will slip through. Smart health systems, multi-location groups, and FQHCs are moving away from manual monthly chores. Instead, they outsource the problem to dedicated teams running daily automated sweeps. Artificial intelligence handles the heavy lifting of high-volume database queries. It executes thousands of cross-references every single day, eliminating human fatigue and data entry errors. But the AI does not make the final judgment calls. When the system flags a potential match, dedicated credentialing analysts step in to review the hit against actual provider data, like NPIs and specialties. This initiates a strict remediation protocol. The analysts swiftly rule out false positive name matches. If a genuine hit is confirmed, they instantly trigger a hold billing alert and notify the administrators before another claim goes out. Relentless AI querying catches database updates immediately, while credentialed human judgment prevents false alarms. Together, they collapse a multi-week exposure window down to a single day, ensuring you never bill blindly under an excluded provider. The manual standard is incredibly expensive to maintain. Between salary, benefits, and overhead, a fully loaded in-house credentialing coordinator costs a practice between $65,000 and $95,000 a year. And even with that overhead, manual monthly checks still fail. Recently, a major Florida health system was forced to self-disclose an $18.8 million settlement. That massive liability originated from just 2 excluded hires who managed to slip through the cracks of their internal screening process. This visual scale weighs your exposure against the modern solution. On one side, you have massive financial liabilities, like that $18.8 million settlement, alongside the $95,000 annual cost of an in-house coordinator. On the other side, Staffing LEIE's daily monitoring service starts at just $399 a week. That $399 weekly investment delivers daily, automated sweeps. You secure a mathematically superior compliance operation for a tiny fraction of the cost of one single in-house employee. The data remains strictly protected throughout the entire process. Outsourced workflows run inside a private stack, shielded by enterprise-grade compliance, holding SOC 2 Type 2 and ISO 27001 certifications, alongside full HIPAA compliance from day one. Daily automated monitoring deletes the 29-day blind spot. It takes an unpredictable, multi-million-dollar federal liability and converts it into a fixed, highly manageable operational expense. Transitioning to this model is fast. Most practices complete their onboarding and go live within exactly 14 days. During the first 2 days of that window, an assigned analyst baselines your entire existing provider roster, auditing every name against every single state and federal exclusion list to establish a clean starting point. Over 800 practices across the United States currently trust this model. Staffing LEIE operates on a low-friction, month-to-month engagement structure with 0 long-term contracts, starting with a risk-free pilot. For any medical practice relying on Medicare or Medicaid billing volume, continuous daily monitoring is the mathematical baseline required to protect your revenue. Because in federal compliance, a single missed exclusion will always cost you more than months of proactive monitoring.